guys, and welcome back to my channel. You are back at it again with Talia. If you're new to my channel, please subscribe, and if you're back, thank you guys for being a part of my life and my journey. I'm so grateful for you guys. Today I am pretty much going to announce that I passed my second competency exam. For those who don't know what a competency exam is to see if you're competent. So I don't even know what competent means. It's to see if you're able, your abilities, you're tested on your abilities to see if you are capable of grabbing an instrument, being able to fulcrum, being able to explore the tooth, scale the tooth below the gingiva, pretty much do what a dental hygienist is supposed to do in the mouth when we are doing preventative care. So pretty much in clinic, you do practice. So this semester, the Explorer, we practiced more on the typodont because it was the first competency exam that we took. So we needed to learn positions, learn the basics. We learned a lot about infection control. So we were going like really slow. So with the curette, honestly, the second time I was just so extremely nervous. I don't know what it was. I just didn't feel 100% prepared in the sense that I knew what I was doing, but I was just so nervous. I don't know what it was. I was just mentally not prepared to take this exam. And I think that's the most important thing about competency exams is you have to really be mentally prepared for them. You have to tell yourself, I'm going to pass this exam. I'm going to do well. You know, it's just a mental thing. Thank God, you know, for my instructors. Thank you so much. Also, you know, your classmates, they help you. Your classmates, you're practicing on your classmates, so they're your patient. For first semester, it depends on the school you're in. I don't even know. Some schools don't even do competency exams in the first semester. So do not quote me. It all depends on what school you go to. Honestly, it takes time, it takes practice, and you just have to really mentally want to be all in. I am really just exhausted. I'm drained. I am literally at the end of the semester. These competency exams, they're hard. They're extremely hard because the instructor is just standing right there behind you while you're working in the patient's mouth, and you're just trying to do your best not to screw up. Most of your classmates are healthy. You're going subgingivally and there's no calculus. So you have to do really little strokes, and it just honestly, as opposed to a patient who has calculus, at least you can feel it and scrape the thing off. No, with your competency exam, you're working, well, I was working with healthy patients, so I didn't even know what I was looking for. All you have to focus on is your position, make sure that your strokes are consistent and they are just what your instructors are looking for. That's pretty much it. Don't worry though, they do prepare you. They do prepare you. Just pay attention. If you have any questions, ask your instructors to help you. But preparing for this competency exam is pretty much just memorizing your positions, knowing your hand strokes, knowing where to fulcrum, mentally wanting to do well. That is pretty much it. You have to mentally want this, mentally prepare, and just know what you're doing. I know if you need a typodont stand, please invest in one. You know, they have typodont stands that you can just literally put on your desk. They have typodont stands like the one I have. My mentor let me borrow her typodont stand, which I am super grateful for. So ask colleagues, ask friends if they can help you, and you will get the help. But they are nerve-wracking. I was crying. I had to step out because they give you time slots. So you're pretty much in your clinic. Half the class goes on Wednesday, half the class goes on Friday. So Wednesday, I was patient. Friday, today, I was clinician. So that being said, I was at 10:45 from 9 o'clock in the morning till 10:45. I am practicing nerve-wracked. Before I went, I stepped out, I bawled out, called my parents. I said, I'm so nervous right now. Calmed me down, went back in, super nervous again. When it was my turn, I was literally shaking. Like, I know what I'm doing. I know what I'm doing. I studied my positions. I know my strokes. I know how to fulcrum, and I'm still panicking. Guys, you really just have to want this. This is something that you just have to want. Nothing is easy. Nothing you do is easy. This is by far the hardest semester that I have ever been in, like ever in college. My college career, this is the hardest semester. You know, it's just, this is it. This is it. We are being prepared to be clinicians. You know, this is something very serious. You're dealing with patients, you know, you're dealing with, you're in healthcare, you're dealing with oral health. And, you know, if you're not doing this correctly, it's not going to work. So you have to know what positions you have to be in. You have to know, you know, if your patient should turn this way, if they should turn that way, so you won't stab them in the face with your instrument. You know what I'm saying? So I don't mean to scare you. This is not what this video is for. This video is to tell you that, can you prepare for a competency exam? Yes, you can prepare mentally and you can prepare physically. The way you're going to prepare physically, study your positions, know your hand strokes, fulcrum really, really hard, rock on the fulcrum. And for those who don't know what a fulcrum is, you will know what a fulcrum is. It is when your middle finger, okay, puts a lot of pressure, builds up on the tooth. Your hand is in modified pen grasp, okay? And you're just literally putting pressure on a tooth that stabilizes your hand, and you do the stroke from there. So by the end of first semester, your middle finger might have a wart or something. I don't know. Physically, that's how you have to prepare, okay? Have breakfast, make sure you have coffee, all that jazz, okay? Second thing, mentally prepare yourself. You have to want this. Call your support system and just want it. Do your best. Do not get nervous. If you do not pass your competency, they will let you take it again. So you don't want to aim for failure, but just know that you can take the competency exam again if you do fail. Guys, I hope this video was helpful. Do not worry if you're taking competency exam. If you are interested in dental hygiene, you really want to get into the program, just know that you will be taking competency exams, and these exams are to test your abilities with instruments in patients' mouths. So without further ado, if you guys like this video, give it a thumbs up. If you have any questions, comment down below. Let me know what you guys think, what you guys want to know. I can answer your questions. I hope this video was helpful. Yeah, so good luck, guys, and thank you guys so much for watching, and I will see you in my next video. Bye.